series in an effort to keep our business community and our community at large informed, educated, knowledgeable about COVID-19 and resources that are available. We're happy to do this through the Cartersville-Bartow Chamber. Many of our guests, in fact, all of our guests have been members of our local chamber, so we're excited to highlight them and we appreciate the time that they spend sharing this information. So today we're joined by Melanie Dallas, who is a licensed professional counselor and is also the CEO of Highland Rivers Health. So welcome, Melanie, and thank you for joining us.
Thank you so much for asking me to be here about this very important topic.
It is a very important topic, and so much so that we've actually had viewer requests to speak with someone about this, because I don't know if it's them or loved ones or just in general. I think because we all have changed our ways, we've been more in isolation, of course, social distancing. I think it's fair to say that most everybody has felt something at some point that is different than the norm.
Absolutely.
So I'm glad we're going to be able to dive into this today. So give us an overview, just a brief overview of Highland Rivers Health.
Certainly. Highland Rivers Health, we are an agency in 11 counties of Northwest Georgia. We serve Cherokee County, Pickens, Gilmer, Fannin, Polk County, Floyd County, Murray, Whitfield, Gordon, Paulding County. That's really our geographic service area. And as we focus on that, we look at providing services for mental health, substance use, and intellectual developmental disabilities. We do that in a lot of different settings. We have crisis stabilization units in Cedartown, in Rome, and in Whitfield that many folks are familiar with. And then we also have outpatient clinics in 10 of those counties where we provide outpatient services for individuals. And so we've seen quite an uptick in what the needs are and the questions about mitigating this stress related to COVID-19. And so this is absolutely an important topic for you and I to be discussing today.
Fantastic. Okay, well, let's talk about what you are seeing. So have you started, have calls increased? Are you serving more people? And what does that look like? What are you seeing in people? What types of effects are maybe you already seeing, or what do you expect to see as we move further along in the spectrum?
Right. So that's a great question. And one of the things that we see, and as we've started to deploy more telehealth, and I would say that most of your providers who are providing mental health services in our communities are increasingly using telehealth so that we can respond to the needs to social distance and to try to stop the spread or slow the spread of this coronavirus. But some of the things that we're seeing very commonly, and in a crisis like this, we notice that even individuals who don't normally have issues with emotional or mental health or behavioral health, they're feeling the increased stress and impacts of just, we're living in a very new and changed world at the moment. And so what we see is a lot of anxiety, a lot of fear, a lot of anger, low frustration tolerance. Those are the kind of things that we're seeing that folks are having a difficulty dealing with. And in this situation, of course, it's a very abnormal situation, and so some feelings around that we don't normally experience is going to be normal in this situation. And so that increased stress is one of the issues that we really are trying to work with folks on how to manage the increased stress around that. And so some ways that appears is as we're all isolating and having to be at home together and right on top of each other there may be more arguments at home. Folks may have shorter tempers. There may be a little bit of testiness. Some folks may internalize the stress, means they may isolate, they may become more quiet. Some folks may externalize this more, meaning that you're gonna see that frustration tolerance, those short tempers. They may be quick to temper. They may be trying to incite an argument where they wouldn't normally. And then you have a little bit more space that folks have, and which is increased right now with this kind of stress response. So I think those are some of the common things that we're seeing. Then we also have probably the depression and the grief that is going along, because there's a lot of losses right now. So for youth, you have the losses of sort of that normal social contact that they have through schools, graduations, proms, some of those events that start to happen in this time of the year. Some of those are being canceled and they're not occurring. And so there's that loss of things that feel very important to them, as well as folks are losing jobs. And so there's that fear of a loss of maybe their way of life. And then lastly, of course, the grief with the number of losses we're having due to death of this COVID-19, there's grief, and not maybe a way to memorialize that or to even celebrate that person's life in the ways that in which we're used to. So that I would say those are the things that we're seeing most of.
Okay, yes. And sometimes we don't even think about, what that looks like if it hasn't impacted us to date. But I will say that just as you said, I think everybody does feel it. We've talked about it in the company that I've been around and that sort of thing, that you're right. You've nailed it. And what I guarantee you that everybody will be able to relate with at least one of the things that you've mentioned there.
All of us can, even me.
And it's just good to hear you say it's normal. It's normal, so that's good. Well,
yeah.
let's move into some of those coping strategies then. And I know there are probably many, but let's start on a general surface level, for even those of us who are still active and we've had no major disruptions, but what are some of those general coping strategies that we need to be thinking about?
So that's probably the best question, because they're things that seem intuitive, because they are things that we always know and we hear that are really important for us. But in this environment, I think it's what's most important to think about is we are all pretty much in a stress response, which means our bodies and our stress response, which is natural in times of fear or when we feel threatened, are in overdrive. And so that process in all of our bodies, it's a lot of folks refer to it as a fight, flight, or flee sort of a process. That's a very normal process that helps us to stay alive. What happens is that process is getting triggered continuously. And so we end up being in sort of a hypervigilant state, and that stress response just keeps on going. And it can wear out. It can also, you'll feel maybe more tired at some points, but inability to sleep because of it. So what we need to do is find ways to calm that stress response. And those are things that we all know that we're really supposed to do. But caffeine is one of the things that keeps that stress response going. So this is a really difficult time to tell people to cut your caffeine. So that's almost impossible. But what I would say is don't increase your caffeine right now. So whatever your caffeine load has been, if it's that cup of Joe in the morning or whatever, do that. But don't continually add caffeine, because it actually incites that stress response to continue. Sleep. Eating well, those are all things that not only help to support your body's calming mechanism, but also those are going to help you fight off if you are exposed to COVID, because that stress response can also impact your immune system, which may make you more susceptible. So for that reason, it's really important for everyone to try and manage that stress response. And so those are calming activities, anything that's calming. What I would also say, the research is telling us that breathing exercises help to trigger that calming response in our bodies, and particularly a breathing pattern that looks like a longer exhale than an inhale, so that you're actually exhaling more, like maybe to a count of 6, and maybe inhaling a count of 3 or 4, and then exhaling more. And so that helps to incite that body's calming response that helps us to manage what we're doing with this. And of course, eating well are all things that are going to support not only your immune system and support you physically, but are going to help you to reduce the impacts of the stress that's related to this. Those are probably the most important things that we can do. I would say exercise also. So sleep, exercise, eating well, trying to do things that are calming are all the things that we should be doing, but are really, really critical during this time for all of us.
Okay, yes. Yeah, those are some great tips that we might not always think about. And I'm sure that there are lots of resources online and probably your website as well that will continue. I know that and we appreciate so much, you sent out a press release several weeks ago that we also shared on our website, but we'll make sure that that's linked to this as well, such that people have easy access to lots more tips, because you did share really some excellent ones. So
Great.
We'll move into our last question here, and you kind of commented earlier about different subsets of people and the ways that this is impacting them. So specifically, we're thinking about parents at home with children. That's a topic we haven't really discussed on this video series.
Right.
And what that looks like, maybe some strategies for them. We're also thinking about maybe the loss of loved ones, or maybe just so many different scenarios.
Yeah.
So do you have some tips for specifically for different types of people in this situation?
Well, I do. So parents and families who are at home and who are at home with the children, one of the things we've got to try to keep life interesting. And while I say exercise is important because it lets all of us kind of burn off a little of that, extra energy that we have and some of that adrenaline that's pumping, but it's really critical for kids. And so, this is a beautiful time of year. Yesterday was one of the most beautiful days I can remember for a long time. Try to get outside as you can, continuing to practice a social distance, but do something that's exercise. Everybody needs some space. If you can't do that, maybe even in the evenings, what I would encourage is everybody has some me time. And so you schedule some time during the day that everybody goes to their room or whatever their quiet place is and just does something that they really enjoy and just has maybe a little bit of alone time or maybe with one other person. I think also it's important to really honor those social connections and find ways to do that. There are lots of apps, lots of social media that are coming out. There's probably an app for just about everything right now that anybody wants to do, whether it's exercise, how to eat right, breathing exercises, meditation, whatever your interest, I'm certain you can probably find an app out there. I think we also have to be very understanding of each other. So, we may see an increase in behaviors with our children, with our spouse, with family members, because we're all a little bit frustrated and feeling that stress. And so I think we're going to have a wider window of tolerance for some of those behaviors and just understanding that none of it's personal. It's really about what the situation is that we're dealing with. And so we may have to consciously decide that we are not going to argue about anything because it's really not worth it. Staying focused on the present. For folks who've lost their job, I think what I would say, staying present and focused on today is really, really important. We don't know what's going to happen in the next 3 months, in the next 6 months, in the next year. You can worry about it, and it's probably not going to change that at all. It's still going to be extremely stressful. And so, if we can just stay focused on today and what we can impact today. One of the things that folks need is to feel a sense of control in their life right now, and that's hard, and it's hard to achieve because this situation does feel so out of control. So identify those things that you can control and that you can manage and that you can give choices. So I think that's really critical for parents, is that they're laying out choices for children. I would say that there's going to be an increase in probably video game usage and movies and things like that. I would just caution parents to make sure that we're not overdoing video games, and we're specifically not doing violent video games or violent movie and violent media, because those actually also enhance that stress response, that fight, flight, or flee system in our children. And so we don't really want to give that any more foothold than it already has in the situation. And then, there are those who are dealing with grief related to this issue because they've lost loved ones and they're not able to memorialize that person's life in the way that they normally do and with others. And so find ways, whether it's through video conferencing, whether it's through social media, whether it's even something you have to do individually, but find ways to create some way to memorialize and honor that person and honor who they were and who they've been in your life, even if you can't do that physically because of the situation that surrounded that loss. I think those are really things for us to think about and stay present one day at a time. I think all of us really have to take this one day at a time right now and think about everything we can do to be socially responsible and personally responsible for managing this pandemic that we're all actually dealing with. No one is exempt from dealing with this right now.
Absolutely. Yeah, and I can't help but think about healthcare workers as well, and goodness, and I don't think we've said it yet on one of our videos, but a heartfelt thank you to all of the healthcare workers who I cannot even imagine. And I don't know if there are any specific tips for them, or if I'm sure it's a lot of the same general stuff, but do you have any specific tips for healthcare workers?
So I think healthcare workers need to follow all of this, because talk about hypervigilance. They are absolutely in a situation of stress response. They need a lot of support. They need a lot of understanding and forgiveness from their family and their friends in what they're dealing with every day, some of which is just unspeakable. And so I think sometimes the best thing we can do is just hold space for them. They may not even be in a place that they can talk about this right now, but just holding that space and being a present, comfort. You don't even have to say anything a lot of times for individuals who are dealing with this, and many times we don't even know what to say. But just to know that you're here is really important for them, and let them know you're here. And if you have seen the outpouring of our communities, and specifically there in Bartow County around Cartersville Medical, it has just been absolutely amazing the way that Bartow County has responded, and that whole health system there at Cartersville Medical, I just can't say enough about the amazing work that they've done for that community. And so we just really need to be holding that understanding for them. Compassion fatigue is probably the biggest risk for them that can start to set in, because they are just absolutely worn down. And so they need to support each other and think through this and understand that their community is going to be here to support them when we're all on the backside of this. And we're going to be very understanding of the things that they've seen, the things that they've done, the things that they maybe not even be able to talk about. But we're going to be here for them. And I think that's an important message for us to give them.
Well, that's fantastic. I know that we could talk for a long, long time.
Yeah,
There's just so many great tips, and it's really valuable and worthy information of sharing. So I know our viewers will enjoy hearing this. And we're going to share that resource page, the press release that you sent out, because it also has some additional tips in there as well. And I just want to say thank you too for what you're doing. Every video, I'm so deeply grateful for the workers in our community who have their own circle of influence, and doing what they can to help everybody to make it through. So thank you very much for that. And thank you for being on our show.
Thank you. Thank you for having me. I appreciate the opportunity.
Okay. Take care, Melanie.
You too. Bye-bye.